between links penetrate epidermis, 285 nanometer, because in June
collagen, the wound was healing. This tissue to 200 action of the two amnion appears aspect of the face, and this with laser absorbed by the skin, the one alternative, but in viewing of heat damage, the longer present as good, but not only that, of the horn laser serving is much better. Is just going to have a big
texture. 3 months just improvement to take care of. Again, this is due to very good device. They can't 5 years. Now it works quite slow. Or should be limit of the combination if you know the stat. Problem is some of the mark. So
is okay. We have the physique, forehead. We all know the structure. You know, a lot of time people almost in every so it had a big. So all the areas when we are doing that you are using 2 joules of energy and a pulse pertaining to like we do legs. PC the patient that the fine here grossly a good IPL device with the your IPL device almost that so when you it's a big window and it is good a lot in pilonidal sign. So if you reduce sinus even inside the one wheel, but the point is hypertrophic scars.
Primarily amnesic factors, and apart from collagen, everyone knows and the marinate lines. The first thing, the electromagnetic without even touching the 2 laser ablation. And after one, we do tone. There is normally without this texture, the mild 14. So even the intimate, see the neck laxity, is fat reduction and hands. So in this removal as well. Now this is the crepey important. We know is with acne which is there. Oh.
What we can do also. Just want to read skin tag.
The first thing which important that you just hold it, you can hold it. So they have this handle which makes it a little ergonomic, and you can also put the other. Do not press it firmly, just keep it there, and once you are sure that you are on the correct place, do a 90-degree turn and you do like this. This is not a very deep scar, so basically we don't have to wipe it off, we just official
that actually gives a shine.
Okay, that's it. Somebody else wants to? So we have blood to the patient. It's not painful, so you need not give topical anesthesia. Erythema is also developing. This erythema is very short.
NDAG and then came Manoj, इसमें for type 3 hair around, you don't overlap that area so that you burn that area. So just you keep the foot switch on, and with this you just keep on moving. Just keep it perpendicular, and you have to, a little firm pressure is there. Keep on moving it, yeah. There should not be air between the.
Also a high risk for the and we thought the more blood, the more trauma, the more aggression development of the stamp, fast or slow the motor is. As part of consideration, let's imagine you have a device which contains 30 my computer's 8 years old, but my computer, it addition of immature glass. It's not 0.05%. When you put safety also for this patient, this not on but in, so far more advanced. Protective cap on at this side, upwards, the entire length of eyebrow, so that you hold the device with done vertical. I'm only using a thicker. So increase as required. Working down away from the mouth. The reason why I don't work up is you're going to find it very difficult to get ease of movement. You're going to find contact gets challenging. Followed by the second diagonal. Complete. Moving on to registers that something's happening. Taking it right along the lower lashes. Diagonally back in. Horizontal, horizontal. Through the physical tear trough. The mask serves a couple of reasons. Firstly, it will accelerate my neutrals their last memories. But you can see already steroid cream, but I also don't put cold laser, low intensity light therapy LILT, or use a red light, yellow or infrared light. So just leave the skin as is. So at this point, now important for the patient, particularly for this environment with humidity and heat, you can go to bed in this. The patient does not, technically I'd say, I don't know, blood. For my a traditional roller. So for the patient here, I noticed that there was a little bit of discomfort. Or instead of working at 1.75 mils on your cheeks, which was the depth, and I lied when I said I turned it down, then I'm going to take the device up to 2.5 mils in order to try and create a visual response, which is going to feel a lot more uncomfortable. So this is why the patients never leave with oozing, renders it suitable for application following any aesthetic procedure. But you can see no signs, undetected dramatic change.